Good day, everyone. And for today's session, we're going to talk about clinical safety. My name is Leodoro J. Labrage. I'm a clinical assistant professor of Loyola University Chicago. So for today's lesson, we're going to have the following learning objectives. First, we're going to differentiate the key organizations leading patient safety movements in the United States. Number two, value the need for leaders, managers, and followers to focus on clinical safety. And number three, learning objectives would be applied concepts of today's expectation for how clinical safety is implemented. Patient safety is a topic important to many hospital and nursing administrators for several reasons. First, hospitals are a common setting for patient safety events, since many patients are in clinical compromised state, and the second one is that the use of invasive devices and procedures which increases risk for infection and harm to our patient. And the safety focus work began with the report "To Err is Human" by the Institute of Medicine in 2000. In this report, it was found that the majority of deaths in many hospitals were attributed to patient safety. In fact, the death recorded was about 98,000 deaths. And most of these deaths were attributed to common patient safety errors. That's why many hospitals are struggling to develop and implement programs to improve patient safety within the clinical environment. And when we talk about patient safety issues, we're talking about the different hospital-acquired conditions, or HACs. And these are conditions that the patient develops while in the hospital being treated for something else and can cause harm to patients. In other words, these are conditions that were not present during admission. It could be that these conditions develop after 2 days after admission, or a week or two. And some of the most common examples of these conditions are adverse drug events. We also have catheter-associated urinary tract infection. We have central line-associated bloodstream infection, Clostridium difficile infection, false obstetric adverse events. We also have pressure ulcers, surgical site infections, and also venous thromboembolism, ventilator-associated pneumonias, and other related events. Among these hospital-acquired conditions, hospital-acquired infections are the largest among the different HACs. So what are the different efforts being implemented by the different healthcare organizations to reduce hospital-acquired conditions? First is accountable healthcare systems, and that includes transforming Medicare from a passive payer to an active purchaser of higher quality, more efficient healthcare. Number two, tools and initiatives for promoting better quality while avoiding unnecessary cost. In fact, there are several patient safety tools that are being developed, especially by the Agency for Healthcare Research and Quality, and most of these tools were directed towards reducing hospital-acquired conditions, and many hospitals are using these tools. The second, and perhaps the most important one, is the passing of the Deficit Reduction Act in 2005, in which the Center for Medicaid and Medicare Services reimbursement changed for things that could have reasonably been prevented if applying evidence-based practice. In other words, CMS or the Medicare or Medicaid will not just pay right away reimbursement to the hospital, especially for those conditions which could be a result of poor practices or neglect from healthcare providers. Aside from the Institute of Medicine, which released the report regarding the number of deaths related to or attributed to patient safety, there are also other organizations that are leading the way in improving patient safety in many hospitals. We have the Agency for Healthcare Research and Quality, and we also have the National Quality Forum. And these organizations incorporate standards and expectation about safety and quality into the respective work. And most of these agencies have developed or released reports that guides healthcare workers towards patient safety efforts. And some of these organizations have actually developed programs or interventions to improve patient safety in many hospitals. And we're going to discuss that in our next few slides. The Institute of Medicine was the pioneer in establishing a framework to improve patient safety through the research, reports, and guidelines. And as I mentioned earlier, their landmark report titled "To Err is Human" highlighted the need for action, for immediate action actually, to improve patient safety and quality in healthcare settings. And other than this document, they have also released several reports which are aimed to improve patient safety in many healthcare organizations. We have the Crossing the Quality Chasm in 2001, Health Professions Bridge to Quality in 2003, Keeping Patient Safety and Transforming the Work Environment for Nurses, which was released in 2004, and the most recent one, The Future of Nursing in 2010, and we're going to discuss some of these reports in the next few slides. One of the most important report released by the Institute of Medicine is the Health Professions Bridge to Quality, which was released in 2003. And in this report, it outlined the different relevant competencies that healthcare professionals, including nurses, should have. And these competencies are provide patient-centered care, work in interdisciplinary teams, employ evidence-based practice, apply quality improvement, and utilize informatics. And if you would notice, two of these competencies, namely evidence-based practice and quality improvement, were all directed towards improving patient safety. And we know already the importance of research and evidence-based practice to transform nursing practice. And the second one, as we have mentioned in our previous discussion, the importance of continuous quality improvement to attain patient safety and improve the quality of care. So healthcare professionals, including nurses, are expected to develop these competencies. And many hospitals in the United States of America, including hospitals in other countries, are now using these competencies when evaluating the work performances of their nurses. Another important work of the Institute of Medicine is the Crossing the Quality Chasm, which was released in 2001. This report contains the different aims of providing healthcare. And again, if you would notice, one of these aims emphasizes safety or patient safety. In other words, healthcare workers, including nurses, who are providing care to the patient should prioritize patient safety. And of course, one of the most famous work by the Institute of Medicine is a report released in 2010, and it is called as The Future of Nursing. And this report provided specific recommendations on how to improve patient safety. And these recommendations included, number one, remove scope of practice barriers. And remember, registered nurses, particularly the advanced practice registered nurses, are highly trained, and actually they're able to provide a variety of services. However, they are prevented from doing such because of so many barriers, including state laws, and in other cases because of federal policies that prevents them from maximizing their capacity as professionals. And this can actually contribute to issues with patient safety. The second one is expand opportunities for nurse to lead and diffuse collaborative improvement efforts. And we're talking again about quality improvements implement nurse residency programs, and we know already how important proper and adequate training for new nurses are, especially when we talk about patient safety. And number 4, increase the proportion of nurses with a baccalaureate degree to 80% by 2020. And it's already 2022, and there's only about 57% attainment of this goal. Now, why it is important to increase the proportion of BSN degree nurses in the healthcare settings? In many research, the degree nurses hold is highly correlated with patient safety. In other words, if we have more BSN degree nurses who are working in our unit, issues related to patient safety is reduced. Number 5, double the number of nurses with a doctorate by 2020. And having nurses with advanced education, such as doctorate degree, is very important in the implementation of the different patient safety initiatives. Number 4, ensure that nurses engage in lifelong learning. We're talking about continuing education and training to improve their knowledge and competencies in nursing, and prepare and enable nurses to lead change to advance health. And number 8, build an infrastructure for the collection and analysis of interprofessional health care. Now, we've been talking about interprofessional healthcare team in our previous discussion, and we already identified how it is important to have an interprofessional collaboration in order to improve patient safety outcomes among patients. In addition to the Institute of Medicine, there are also other agencies in the United States of America which are devoted to improving quality, safety, efficiency, and effectiveness of healthcare, and that is the Agency of Healthcare Research and Quality. And one of the most important work of this agency is the development of Team STEPS program, or the team strategies and tools to enhance performance and patient safety. It is a teamwork system designed for healthcare professionals to improve patient safety within the organization by improving communication and teamwork skills among healthcare professionals. And this Team STEPS program is actually a training program for healthcare workers. Now, you would notice that the focus of this program is on improving teamwork and communication, and it's all because that many experts on patient safety agree that teamwork and communication are both essential to the delivery of healthcare and to prevent and mitigate medical errors and patient injury. That's why the focus of this program is on teamwork and communication. Now, if you try to look at the diagram, the Team STEPS program has actually 5 key principles, and it is based on teamwork structure with 4 teachable learning skills. These are communication, leadership, situation monitoring, and mutual support. You would notice double-headed arrows which depict a two-way dynamic interplay between the 4 skills and the team-related outcomes. What are these? Performance, knowledge, and attitudes. And the interaction between the outcomes and skills is the basis of a team striving to deliver safe, quality care and support quality improvement. And encircling the 4 skills is the team structure of the patient care team, which represents not only the patient and patient caregivers, but also those who play a supportive role within the healthcare delivery system. In addition to the Team STEPS program, which was developed by the Agency for Healthcare Research and Quality, this agency also issued a report on evidence-based practices titled Making Healthcare Safer. This report contains various aspects of care, such as the use of perioperative checklists It contains interventions to reduce urinary catheter infection and hand hygiene protocols, interventions to reduce falls, interventions to reduce pressure ulcers, and many more. The Agency for Healthcare Research and Quality has also formulated 5 steps for safer healthcare, which is very important, especially for patients. Number one, ask questions if you have doubts or concerns, and this is very important. As a healthcare provider, you should be able to tell your patient to ask questions whenever they have doubts or if they have questions related to their treatments or medical conditions. And number two, keep and bring a list of all medicines that you take. This is very important, especially if the patient is taking multiple drugs and the doctor would wanted to know exactly what are the drugs the patient is taking to avoid any adverse reactions because of possible drug-drug interactions. Get the results of the test or procedures. This is very important in order for you to know if you have problems with the physiologic functioning of your body, and you should be able to tell your patient to ask when and how to get the result of the test. Talk to your doctor about which hospital is best for your healthcare needs. You should be able to tell and advise to your patients to which hospital they're supposed to go, particularly those hospitals that provides the highest quality of care, and preferably those hospitals which are accredited, like for example by the JCI, because they are known to provide the best care to the patient. And number 5, make sure you understand what will happen if you need surgery. This is very important because in most cases, we always assume that the patient who's undergoing surgery knows everything about the surgery itself. However, as nurses in particular, you should be able to assess the understanding and the comprehension of our patient. And the nurses are in the strategic position to do this. In addition to the Institute of Medicine and Agency for Healthcare Research and Quality, there's another organization which is devoted to improving quality and safety in healthcare, and this is the National Quality Forum. And 2 of the most important work of the NQF are, first, it provides source for Centers of Medicare and Medicaid's never events. Remember that Centers for Medicare and Medicaid is responsible for hospital reimbursement or paying the hospital. And CMS will not pay for certain conditions that result from poor practices. And these sources are usually derived from the National Quality Forum. The second one is that the NQF also serves as a resource for healthcare facilities accreditation. Now, what is this HFAF? This is a nationally recognized accreditation organization, which is the deeming authority of the CMS, or the Centers for Medicare and Medicaid. And normally, this accrediting agency provides accreditation programs for hospitals, clinical laboratories, ambulatory surgical centers, and other healthcare institutions, including rehabilitation facilities. And of course, if the facility is not accredited because of issues related to patient safety, then that's really a big problem on the facility and the hospital itself. In addition to the Institute of Medicine and Agency for Healthcare Research and Quality, there's another organization that is devoted to improving quality and safety of healthcare, the National Quality Forum. And among the different initiatives provided by this organization is that, first, it provides source for Centers and Medicare and Medicaid's never events. In other words, the NQF advises the Centers for Medicare and Medicare Services about measures that can be used to determine payment or reimbursement. Remember that the CMS is responsible for hospital reimbursement, and CMS will not pay for certain conditions that result from poor practices or that practices or actions that causes compromise in patient safety. The second one is that the National Quality Forum serves as a resource for healthcare facilities accreditation program. Now, the HFAP is a national recognized accreditation organization, which is the deeming authority of the CMS, and it provides accreditation programs for hospitals, laboratories, healthcare centers, office-based surgery, and it also provides accreditations to other mental health and rehabilitation facilities. And normally, if certain facilities, certain healthcare agencies or institutions are not accredited, more or less they might be having problems when it comes to payment from the CMS as well. In addition to the three mentioned organizations, there are also other organizations in the United States of America that are leading patient safety movements, and one of the most important organizations is the JCI. We know already JCI because this is a recognized global leader in healthcare organization. And the JCI, as we all know, provides guidelines and standards for healthcare providers and stakeholders on how to improve patient safety. In addition to that, we also have the QSEN, or the Quality and Safety Education for Nurses. And this is actually a project which was designed to create competencies for nursing. And what are these competencies developed by the QSEN? Patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. And again, these competencies, which are developed by the QSEN, are intended to be included and integrated in the nursing education. It should be included in the nursing curriculum because these competencies are directed towards improving patient safety. In other words, students should be able to develop these competencies during the nursing education so that when they start working in the hospitals, they're already ready, they are equipped to provide effective and safe patient care to the patient. And of course, we also have the magnet or the magnet designation, and we have discussed this before. The magnet designation, as we've mentioned before, is a recognition given to hospitals who adheres to safety and quality standards. In other words, if the hospital is designated as magnet, it is safe to say that the hospital is providing safe and effective and quality care to their patients. We also have the Institute for Healthcare Improvement. And the Institute for Healthcare and Improvement is very important because it developed a tool, namely the Global Trigger tool, which is being used by many hospitals to determine harm to patients. And of course, the Press-Ganey, basically the Press-Ganey issued a report about the current workplace safety in the United States of America and in many hospitals in the United States of America, and how this workplace safety affects nursing and patient outcomes. Now, we're talking about the JCI initiative earlier with regards to patient safety. And the National Patient Safety Goals are one of the major methods by which the Joint Commission establishes standards for ensuring patient safety in all healthcare settings. And in order to ensure healthcare facilities focus on preventing sources of patient harm. And the major focus of these patient safety goals include promoting patient safety and preventing hospital-acquired infection, medication errors. It also focuses on inpatient suicide, and also about patient identification and prevention of mistake in surgery, and improving staff communication. Now, these areas, these focus are actually very important because most of the patient errors occur within this area. For example, in identifying patient correctly, the JCI suggested several ways in how to prevent errors in patient identification. For example, use of at least two ways to identify the patient. It could be the patient's name and the date of birth, and improve staff communication. Again, the JCI suggested to get important test results to the right person in time, and to prevent medication errors. Again, the JCI suggested several ways in how to prevent medication errors. For example, proper labeling of the medication, which is very important. And also is the proper recording and passing correct information about the patient medications. Now, these are important suggestions to prevent medication errors. Other areas of concern with regards to national patient goals are the use of alarms safely. And it has something to do with the alarms on the medical equipment, and that staff nurses, including nurses, are able to respond it on time. They also suggested several ways on how to prevent infection, for example, hand hygiene guidelines, and how to improve compliance to hand hygiene guidelines. And other than that, they also suggested several ways on how to prevent patient safety risks, such as reduction in suicide risk and reduction in errors when it comes to surgery. In other words, they have formulated several ways in how we can prevent mistakes during surgery. For example, making sure that the correct surgery is done to a correct patient, and it is done in a correct patient's body, because one of the most common patient safety issues in many hospitals is that surgery is performed in the wrong patient, or either the surgery is performed in the wrong patient's body. And the other one is correct placement of the patient's body where the surgery is to be done, and posing before the surgery to make sure that the mistake is not being made. Now, these hospital national patient safety goals are actually being implemented by many hospitals in the United States of America, and they're constantly monitoring the compliance of these hospitals to these safety goals. And again, the purpose of these safety goals is again to improve patient safety. Now, what is the role of the nurse managers and nursing leaders when it comes to patient safety or clinical safety? Of course, as a manager, as a leader, you can use the IOM competencies to frame your actions. As I mentioned earlier, the IOM formulated relevant competencies that should be mastered by healthcare professionals, including nurses. And in many performance evaluation, in many performance assessment of healthcare workings, including nurses, the IOM competency serves as a framework for this evaluation. Number two, creation of a positive work environment, and that includes implementation of a culture, developing a culture of safety. And number three, engage staff in addressing safety issues. It is very important that staff nurses who are on the front line, who are in the direct care link to patient care, are the best resource to provide us inputs related to patient safety issues. And remember, during our previous discussion, we've been talking about shared decision making, shared governance. And when it comes to patient safety, involvement of staff is very important. Strengthen shared governance. We just mentioned this one, and this is very important because if a shared governance is implemented in the hospitals, staff nurses would have sense of ownership and they would take that decision and they would be willing to fulfill that decision related to patient safety. And of course, the last is formulate clinical safety committee. This is very important because the committee normally oversees clinical safety initiatives, monitor, do surveillance about the implementation of the different patient safety initiatives. And many hospitals have actually clinical safety committees. However, there are still other hospitals who are not doing this, and it is very important that as future nurse managers and leaders that you should be able to develop one.